Yeah, just look at me.
Okay.
And can you move your necklace? It's clicking on the microphone. Maybe stick it inside your watch shirt.
Is that okay?
Very good. Thank you.
Just move it out of the way.
I just heard some clicking. If you just say your name and spell it.
Okay, Amy Ball, Amyball.
And you're from, where are you from?
Newcastle.
Newcastle.
Mm-hmm.
And you did your, I guess you did the pre-work for this, you did in Muncie.
Mm-hmm, did it at Ball State.
Tell me your impressions of the program. What do you think so far?
Well, I like it a lot. It's very hard. I mean, you have to, it's hard to raise a family with it, but it's a good program. And it's hard to start off when you have a family at home, but you have to learn how to manage your time, and you can get through it. It's a lot of studying, but it's a very nice program.
We talked to Andy earlier. He already had a degree. Have you had any other school? So this is, you jumped right in.
I jumped right in, yeah.
What made you decide to go in this field?
Well, I work in a hospital already at Henry County Memorial Hospital, and I got to see, different aspects of the X-ray program. And I know I wanted to get into a medical field, and I knew I didn't want to be a nurse, but I knew that I liked X-ray because I've been around X-ray, and that's how I wanted to go into the program and everything. And I also like to help people, and you're there to help diagnose people. You're there for them to help in their diagnosis by taking their pictures.
You say it's pretty difficult.
Mm-hmm.
Is it all the information you have to learn, or is it the procedures?
Well, you have to learn a lot of information really fast in this program because it is only a 14-month program. And it's a fast pace, and you got to keep up on your studying. And if you fall far behind, that's going to hurt you. So you have to keep up on it. But it's a lot of information, but you can do it if you study.
Yeah, it's you're getting out in 2 years. Some people.
Oh, I've been in 4 years.
4 years, so you've taken a little longer.
Mm-hmm. Yeah.
Do you commute from Newcastle?
Yeah, I commute back and forth from Newcastle every day. I ride with my friend Lisa.
Tim, could you rephrase your answer to, instead of saying it's a 14-month program, to say because the clinic is
14 months.
Because that's misleading. Someone
That's true.
seeing that would say, oh, gee, you can do everything in 14
Oh,
months.
no,
All right.
yeah, all right. Oh,
Okay,
yeah.
the clinic is 14.
Yeah, that's right.
Let me
You want to
see.
be more explicit.
Okay, the clinic routine is 14 months. Is that what you want?
Well, just
The whole thing.
well, yeah, complete thoughts.
Here we go.
No,
Okay.
well, compared to someone who's taking like a 4-year program, and you mentioned this was kind of difficult.
It is kind of difficult, and the whole program's a 2-year program, but your clinic is a 14-month program, and there's a lot of information that you have to have. In the 14-month, it's a fast pace, and you got to keep up with the fast pace. So you got to keep on top of your studies, because if you get far behind, then you're out of legs. But you got to keep up with it.
So how's your grades?
I'm doing real good.
What would you say to someone who may ask you, wow, that looks like fun, or maybe a high school student or another coworker at the hospital interested in the program? What would you tell them?
I would say, it is fun. But again, it's a lot of work. You got to be willing to put in all your time and effort into it, and it's great.
Do you have any knowledge of any other programs outside of Ball State? Why did you choose Ball State?
I chose Ball State. Number one, for me, it was closer to home because I do have a family, so it's easier for me to commute back and forth. And this seemed more of it was a degree. I could get an associate's degree out of this, and I liked that aspect better. I like the fact that I was going to be at Methodist because it is, one of the biggest hospitals in the United States and everything, and I'd get to see a lot more and being exposed to a lot more than most of the hospitals around here. So.
Would you like to add anything else?
No.
Okay, thank you.
One of those weight loss commercials, huh?
No.
I lost one.
First part's real easy. If you just tell me your name and
Okay.
spell it, please go ahead.
Brooke Weathers, BROOK, WEATHERS.
Okay, Brooke, where are you from?
I live here in Indianapolis now.
Did you do the first first part of your studies at Ball State?
I was there a semester. I began at Franklin College and discovered this program. I didn't really even know about nuclear medicine. I discovered it through an internship that I had there and decided I liked it and wanted to pursue it.
Wow, that's pretty neat. I guess they have a program down there where you take a lot of internships.
During the month of January, they have what they call winter term. So
That's right. Yeah.
I went to a hospital for mine.
And learn. So what do you think of the program so far?
I've enjoyed myself. I think that as far as patient contact and learning experiences and classwork, I've been pleased.
What is nuclear medicine?
What is it? There's a lot of different aspects, but the most common thing that people do is they use radionuclide tracers, radioactive tracers, to image different parts of the body. It's more of a physiological function kind of area as opposed to X-ray where they're just looking at the anatomy and the structure. This looks at how well things work. How well does a gallbladder work? How are there any fractures or things like that, small fractures in bones, or are there any infections in the soft tissue around bones, things like that.
So you use it for diagnostics?
Mm-hmm. For the most part it is.
Any treatment as well?
Yes, there is. As far as thyroid cancers or hyperthyroidism, there's a lot of I-131 treatment done on those kinds of patients.
So you were actually at another college,
Uh-huh.
and you found out about the program, and you decided that you're now a
That's
Ball
right.
State student.
Yes.
How would you classify the program as far as college programs? You've had experience with other colleges, I guess.
Mm-hmm. I enjoy kind of it's really different from what I've had before because we're not on campus. And so it's a little bit hard to compare campus and off-campus experience. It's a totally different world. Could you ask me a little more specific question?
Well, let's talk about that. How important is it that you're not on campus?
To be doing this, I mean, you couldn't do these kinds of things probably any place else but in a hospital. I mean, you have to have patients, and so we need to come to the hospital. So it's very important that you have a good background that you can get in the classroom so you understand what's going on before you get there and are working with patients, because what they're concerned about is their health, their lives, and they don't really want to have to wait around for you, to know, what's going on. So you have to have a good foundation before you come in so that you can act with competence once you get here and, understand enough about what's going on that you can not be kind of past some of that and show compassion. And, you learn the equipment and you learn how to, a lot of the scheduling things, or there's a lot of surprises that you don't realize, a lot of work that you don't realize that people have to do on a regular basis, a lot of scheduling and appointments, and there's a lot more contact than I realized with, the file room, the doctors, the nurses. There's a lot of different kinds of people that you have to interact with, and I enjoy everything that I've learned here in the clinic, but there's just a lot of different aspects to it.
You're actually working with the patients now?
Mm-hmm. We're always supervised. It's not as if, we run out and get somebody and do an exam on them without any kind of order or anything like that. I mean, the physician is the one who orders the studies, but, we can carry out and work with the equipment, position people. We can do a lot of different things.
Terrific. If you have anything else to add, I just make sure I was asking. When do you finish your studies here?
In July.
And you had a date me.
David, if you would say your name and spell it, please.
Dave Reisman, Davidreisman.
And what are you studying, David?
Nuclear medicine.
And when did you start down here?
Started in April, is that right? May.
May. Did you do your studies where are you from?
From Greensburg, Indiana.
Okay. Did you do your first part of this at Ball State?
Yeah. Took a year and a semester. 3 semesters.
Did you know right away this is what you wanted to do when you started?
Actually, I originally wanted to be an X-ray tech, and through, I don't remember what's that day called when you guys come to Ball State?
Okay, how we do orientation, or I don't know what that we call it.
A career day?
Career day.
Yeah.
Yeah.
Yeah, well, the faculty members from the various programs come up on
Okay.
campus, provide information, career day, I guess you could say.
Originally, I was interested in being an X-ray technician.
Technologist.
Technologist, sorry.
Say the whole thing.
Originally, I was interested in being an X-ray technologist. One day at Ball State, they had a career day. I saw the nuclear medicine program. I applied for both. I got into nuclear medicine. It interested me more. The hours are a little better. Pay scale's a little better. That's about it.
You're looking at something also kind of in the health field as well. Is this something you like to do? You like to help people, or is it part of it?
When I was younger, I had a couple bone fractures, and that interested me, being at the hospital, watching what was going on. I have a few relatives who are X-ray technicians, and that's about it.
So far, so good. As far as the program as you're doing, is everything going all right?
Yeah, it's moving right along. It was more difficult at first, but once you get the basic classes out of the way, you understand what's going on, it's not too bad.
And you are now here at Methodist Hospital working with the patients. What kind of stuff do you do, or what's the most recent thing you did with a patient? Have you seen one today?
Right before I came up, we did a lung scan to check the function of the lung, check for pulmonary emboli. It's really important when you have blood clots. The clots form wherever in the body, and they go directly to the lung. From there, they can dislodge and go up to the brain, and that's when you have a stroke.
So you had the potential, if you catch a clot, of saving someone's life
Yes.
by the work that you're doing. So that's pretty good. Do you, if you had the opportunity to talk to someone about this program, if they were interested, what would you tell them?
Should I talk about the job market or not? No.
Maybe someone who likes
your clinical experience, I think.
Yeah. Maybe someone who likes the area, but you want to persuade them to come to this particular program, the Ball State.
Your background, how are you using your background courses?
Okay. From Ball State, there are, of course, with any college, there are some classes that don't really pertain to what you're doing. But when it got more into the maths and sciences, with the physics, algebra, we do some calculations, drawing up doses, working in the hot lab, where you take a radiopharmaceutical, take the radioactive part and the pharmaceutical part, add them together. There's a lot of calculations. Doing quality control tests, making sure the tag is correct on the radiopharmaceutical, making sure there hasn't been contamination of the department with a Geiger counter.
So your first classes really prepare you for your clinic then,
Yes,
and that's pretty important, you think.
very. One of the classes that don't really pertain now, I guess it does in an off the wall kind of way, psychology. People think that's not real important, but I really got a lot out of that class when I was at Ball State.
To help your patient interaction.
Yeah.
That's good. Anything else you'd like to add, David?
Not that I can think of.
Okay.
Passing out.
Yeah.
You need any of this out of your way?
It's fine. Just have them go right ahead and do it.
Okay.
Will that
Okay, now, problem is shut it off.
fine?
There you go, yeah.
I'll probably have you.
And you want to try to get up here again. You're going to, we don't have any alcohol wipes, I didn't bring any in here. The first thing you want to do is go ahead and clean off the site where you're going to make the injection. Okay. Now that you have that cleaned with the alcohol wipe, take your syringe, make sure that you have not contaminated your site of injection, and make your injection. Draw it back to make sure you're in the vein. At least you're trying to get. Now make your injection. Take your alcohol wipe. Remove the syringe. Okay.
That's good. So tell me your name and spell it, please.
Okay. My name's Linda Van Scoder, and it's Linda, L-I-N-D-A. Van Scoder is 2 words, V-A-N, capital S-C-O-D-E-R.
Okay, Linda, what's your title?
I'm the Respiratory Therapy Program Director.
Very good. I need a chair. That way you don't look up.
Good idea. Looking up at you and talking. Good
So,
idea.
yeah, very
Okay.
Tell me a little bit about the program and here at Methodist and how it works over there, particularly how.
Do you want me to look at you or at the camera?
Look at me.
Okay. Respiratory therapy is an associate degree program that Ball State runs in conjunction with Methodist Hospital. Students spend about 1 year on campus doing prerequisite coursework, and then they come to Methodist Hospital where we have classroom, laboratory, and clinical courses. We also use other clinical sites in the Indianapolis area as well as Ball Memorial Hospital in Muncie.
How's the arrangement work?
The arrangement works very well. Students get a good academic background while they're on campus. They get a good foundation in the sciences before they come to us. And then we have a lot of clinical experience in the Indianapolis area where there are obviously a lot of patients for them to work with. And they can do work in the hospital, the clinical work in the hospitals, as well as home care. We do some extended care facility work as well. So the students get a really good variety of clinical experience here.
Once they're finished with a 2-year program, correct? Once
Yes.
they're finished with the 2-year program, what kind of things does it prepare them to do?
Once our graduates finish our program, they get an associate degree in respiratory therapy, and they're eligible for state and national board exams, and they can become registered respiratory therapists. I'd say the majority of our graduates work in hospitals, but we also have a lot of graduates who go into home care or extended care. They could go into medical sales, teaching, business end of respiratory care. All of that's available to them.
How does this compare with other programs across the country as far as the arrangement with the university and the hospital?
Our arrangement between Ball State University and Methodist Hospital is a little unusual as far as respiratory therapy programs go, because usually the clinical coursework is integrated throughout the entire 2 years of the program, as well as integrating the sciences throughout the program. We do all of the academic and science work up front, and then we have a concentration on clinical work for the last year. I think it's very helpful. Not only do we get students into the clinical courses who are extremely well prepared in the sciences so that we can teach the courses at perhaps a higher level, but we also allow the students to concentrate on the clinical coursework entirely for a year.
But you also have an exam coming up, so you also have some some other?
Oh, the clinical coursework, and when I say coursework, that is classroom, laboratory, and work with patients. Those are what we would consider to be our professional courses. So it isn't all just working with patients in the hospital. When you come to us, there is still classroom and there is still laboratory work.
How could you classify the amount of interaction the students have with the patients?
The students have a tremendous amount of interaction with patients. Of course, that's supervised interaction because they are students. But the students, as they learn things in the classroom, they practice them in laboratory settings that are very controlled, and then they go to their clinical sites where they work directly with patients, very much supervised, but they are working directly with patients to make sure that they are very skilled at what we're preparing them to do when they graduate.
Anything else you'd like to add?
Can't think of a darn thing. Anything else I should say?
All right, Jim, first off, if you'd say your name and spell.
Okay, my name is Jim Wirrell, W-I-R-R-E-L-L.
What is your title, Jim?
My title is Director of the Medical Imaging Programs, which includes the associate degree programs in radiography and nuclear medicine.
And you just look at me. Director of
Medical Imaging Programs.
Imaging.
Okay.
Methodist Hospital.
Well, actually, Ball State University.
Wow. That's even better.
All of the faculty who teach here at the hospital, we have all of the faculty who teach here at the hospital, we all have academic appointments at Ball State University within the Physiology and Health Sciences Department as adjunct faculty. There is a contractual agreement between Methodist and Ball State University for Methodist Hospital to provide both the classroom and the clinical training for the allied health students for 4 of the programs that are now, actually there's 5, I should go over that again, yeah. For the 5 allied health programs that are located at Ball State and Methodist Hospital.
Tell me a little bit about how the program works with the relationship with Ball State and the classes.
Yeah, I think we have a very solid relationship with Ball State. We have good interaction with the faculty on campus and the advisors on campus where our students prepare. They take 30 hours of credit within the area of the sciences and general studies, and then they apply to the clinical portion of the program, which is competitive. And then once they're here in the Indianapolis area, depending upon the program, they're either here for 12 or 14 months. Then they remain Ball State University students. They continue to pay their fees and tuitions directly to Ball State. And they have all the privileges of being a Ball State student. It's just that the faculty now are clinical faculty associated with the program through the arrangement between Methodist Hospital and Ball State University.
I think it's very unique in that instead of a laboratory saying they're in a clinic and they're actually with the patient.
I think so. Our teaching in the classroom is geared to theory that the students take with them over to the clinic and where they perform patient examinations as part of their clinical training. Many times the students have an opportunity to put clinical theory that they may have just learned within the previous few days into practice in the clinic by performing certain types of patient examinations. And I think our students have an excellent relationship here with both the physician and technical staffs of the hospital. There's interaction between our students and patients, the physician staff and the technical staff, without whose help it would be almost impossible for our students to obtain their clinical training.
This is, you've been here for several years.
Right.
Maybe you could, how does this affect not only, obviously, Ball State and Methodist and the student, but how does it reach out and benefit the state?
We've been affiliated with, our programs have been affiliated since 1985, and we have graduates from our programs now who work throughout the state, and plus many of them have also relocated out of state, but the majority of our graduates do stay here in the state, and we have many graduates now who are in hospitals throughout central, northern, and southern Indiana. And I think it helps because when our graduates get out there and the employers see that our students, our graduates can perform, okay, it means that if indeed they have openings for staff positions in the future, that they will come back to us asking us to recommend our graduates to them.
You have a pretty good placement rate?
I think we have an excellent placement rate. Unfortunately, I don't want to say that because it's getting a little tight, but I think we have an excellent placement rate.
As far as the job market, there are plenty of positions for...
The job market is in somewhat of a flex right now, in that there's availability of positions more in for some graduates than other graduates of programs. It depends upon the program you select. Some departments are very small, others are large. For example, radiographers are usually employed mostly by hospitals, and many hospitals of course are open 7 days a week, 24 hours a day, so there's many more employment opportunities for radiographers than, say, for radiation therapists or nuclear medicine technologists.
So this program helps position our students to be, as graduates, to be up for those positions.
Right. When the students graduate from our programs, they can take national certifying examinations, and our pass rate is excellent on our national certifying examinations. And once the student passes the national certifying examination, essentially that provides them with a mechanism to work in any state within the United States.
We had mentioned, a couple of students mentioned how rigorous and how difficult the studies and the program is, and we talked on campus this morning about how it's harder than some students realize.
Right, it's very difficult. One, allied health training has a lot of stress involved to it, because once the students are here, they're no longer able to pick and choose the courses that they must enroll in. We tell them what courses they must enroll in addition to having enrollment in classroom courses, then they are also in the clinic. And depending upon the semester of the year, they're averaging anywhere from 25 to 40 hours per week in the clinic. The first 3 semesters is a combination of clinic and classes for the medical imaging programs, and then the last semester they're in the program, it's strictly clinic.
Anything else we need to cover?
I don't think so, yeah.
Okay, good.
Okay.
This is a lunch that stays with you.
Yes, yes. Whenever you're ready, we'll roll. Okay. Tell us your name and spell it.
Are you serious?
Yeah, because the guy that watch this, he'll take it down.
Wayne Payne, W-A-Y-N-E, P-A-Y-N-E.
And your title.
Professor, Department of Physiology and Health Sciences.
Okay. Because when they look at this, they'll write it out for your nameplate. The guy over in Teleplex.
I see.
He'll listen to that.
Okay.
So if you misspell it.
So P-A-I-N, P-A-I-N-E, P-A-Y-N-E.
Tell me the what are the two-year degree programs? How many are there involved?
There are 5 programs. We have one in radiography, nuclear medicine, respiratory therapy, radiation therapy, and emergency medical services.
And when we say two-year degree program, that is not a 4-year college degree. So
That's right. It's an Associate of Science degree, and it represents 2 years of work. The first year is preclinical in nature, and those classes are taken here at the university, and then the student applies for admission to the clinical phase, which is at Methodist Hospital in Indianapolis.
He applies, or the student applies, doesn't mean the student's going to get in.
No, these are competitive programs based largely on grade point average, particularly grade point average earned in science classes, including chemistry, physics, mathematics, anatomy, and physiology. So in a sense, they're somewhat like medical school and dental school. We have more applicants for the clinical classes than we can accommodate at Methodist, and they choose from the pool of eligible students that the university supplies them.
What happens to the student who does their first year here and doesn't get into clinical?
Well, they certainly have an option of repeating classes in order to improve their grade point average. Any of the classwork taken in the associate degree is applicable to the 4-year degree, should they choose a 4-year degree program. So really, even if they are not successful in the first situation going on into the clinical years, their work can be applied across the curriculum. So it's not as much of a problem as it might seem.
Why? What's the advantage of doing a 2-year program like this?
Well, currently those fields believe that in almost all cases, 2 years, including a rigorous preclinical year, is adequate preparation. The field may go to 4 years, and there are a few 4-year programs, but right now it appears that 2 years with the associate degree gives not only adequate background, but it allows the student to form a foundation on which he or she may develop a 4-year program.
Ball State and Methodist working this relationship, how long has this been going on?
It's been going on for about 6 years, I believe. That's not a...
Okay.
I'm sorry you asked that. Edit that out.
Well, we'll ask Jim.
Okay. This actually was a Butler program, and they decided they did not want to have associate degrees at that university, so it came to us, but that's only historical. It's been going on roughly 5 or 6 years in terms of Ball State's involvement.
Well, how does the university feel about it? How does the department
Well, the university feels very strongly about it. It offers new options for our students. We've always had a few 2-year degrees, but this adds several more. It provides a vehicle for higher education for those students that might not at least currently be interested in a 4-year program, but they certainly would like to have an experience like this. It meets the needs of the disciplines involved. Most of the programs are 2-year associate degrees, so it's a very nice fit between the needs of Methodist and the needs of our students.
Where are the students coming from? Were they thinking about, one day I want to be a doctor, one day I want to be a dentist, but now I think I'll take this 2-year degree program?
We have certainly most of our students are coming in from high school with the intent of being in the allied health science field. So we have a fair number of students that are gravitating into these programs from related programs at the 4-year level, such as medical technology and nursing. We have some students that are applying who have degrees in hand, and for some reason the job market has not been satisfying or has not been adequate, and these jobs seem to offer an alternative, so they apply for an associate degree.
Speaking of the job market, is it good once the degree is completed?
It has been very good, but like almost every area of the health professions, there's a great deal of uncertainty about what is going to happen in terms of funding and utilization. So we have been noticing some reversal in that trend. Interestingly, however, we have noticed the development of temporary services in which technicians are working for agencies that supply technicians on a as-need basis, and those opportunities seem to be quite prevalent now.
You said there are other two-year degree programs. There are some four-year degree programs. Why would a student, what's the advantage of choosing Ball State in our allied health science?
Well, certainly 2 years seems more attractive than 4 years if one is interested in being a clinical technician. If one has aspirations to move vertically, to be an administrative technician, to be in a clinical teaching faculty situation, for example, the 4-year degree might make more sense. But first of all, there aren't a lot of those programs, only one in Indiana. And secondly, the field is at the associate degree level right now.
So where's the advantage of choosing Ball State?
Well, we have, first of all, an excellent faculty and excellent facilities to do the preclinical work. We have a very strong relationship with Methodist Hospital, and Methodist is one of the largest hospitals in the United States. So the experiences gleaned at Methodist will be state-of-the-art, and they will serve the student well regardless of the practice setting that they go into. A student trained at Methodist Hospital will see things that will be seen in few other hospitals, and that student will be prepared when those kinds of technologies arrive later at a smaller hospital or a hospital in another area. So it's an excellent preparation for future employment.
What's the size of the class in each of those particular areas?
In nuclear medicine, that is the smallest class. Methodist generally accepts 10 students. In radiography, they accept 20. In respiratory therapy, I believe the number is 22. In radiation therapy, our newest program, I think that number is yet flexible, but it will also be a small number. And in the emergency medical services, I believe they could accommodate as many as 20 students.
So an EMS, an EMT, gets a 2-year associate's degree. Is that standard? Is that what EMTs go through today?
Well, no, this is the highest level of trauma care, and in fact it requires that the student entering the program have the basic EMT training, and this creates somewhat of an unusual student because most of our students have not had this experience, and they certainly do not have this level of certification. So we have been somewhat less able to supply students to Methodist for this program than the others because of the interesting requirement pertaining to the initial level of expertise and certification.
How do you sell this program to somebody? What do you go out and tell them?
Well, first of all, I guess I would ask them if they really want to be in a highly technical field that involves people, some of whom are hurt, ill, in some cases near death. And if a student has thought about those important criteria and they are interested in the healthcare field, then I tell them that this is an excellent option in terms of all of the parameters that they would be interested in. It is fairly short term relative to other 4-year programs and graduate level programs. It's technically challenging. It is certainly necessary for the healthcare industry to have highly competent and highly trained people, so they would be a valuable part of a team. And if these are the kinds of things that appeal to them, then certainly our program is among the best.
And then I'm going to ask 2 of you to go position somebody for a PHS. And then we're going to go over there and do PHS, and then I'm going to hold up the skeleton thing and say we're looking for 10 posterior ribs on inhalation, you know, that kind of thing.
We have to come back here and expose.
Just position. This, I guess we hang the x-rays upside down like they always do on
Yeah.
those ER films. Today we're talking about the optic foramen. We've been studying the skull in class. We do know that the optic foramen is located in the back of the orbit. So we're going to take oblique views to open up that optic foramen. The reason we want to look at that is because sometimes during trauma, if there's any trauma to the optic foramen, it will be smashed and then we'll lose our eyesight. So we want to make sure that we get the optic foramen open. As you can see on these obliques, this is right and this is left. The orbit rim, and we can see the optic frame in the center. Down here, though, can you see that one? No. What we're missing is it's rotated. It's probably right down here. This is under-rotated, so therefore we're not seeing that optic foramen nice and open like we are here. Okay? It's very crucial that we rotate the body. Just the right part that you have is cartilage. There is nose, though, that is attached to the skull. Here on these films, we have 2 sets. You can see the actual skull back here, and then it comes out, and then there's the bone that's actually in your nose. These are obviously tell on these up here that these have been pretty messed up. We kind of like to see the back into the skull area better, and then up in here we kind of lose some of that. These need to be centered a little further back so we can get all the way up in there. It's obvious that this nose is broken, but the doctor really likes to see the attachment between the nasal bone and the skull, so we do need to get back just a little further. Okay. The name of this break is actually what we call a comminuted fracture. It's when it splinters in many multiple pieces. This is a set of a KUB and upright. And does anybody know what a KUB and upright, what we're looking for in a KUB and upright? Why do we take KUB and uprights? For air. Air where? Where are we looking for the diaphragm? Up underneath the diaphragm. We want to make sure we see that air up underneath the diaphragm. So we do an upright check, the kidneys and the ureters and then the bladder. So we want to make sure everything's on. So we want to make sure we get that symphysis bone on the bottom, at least on our KUB and upright, okay? We do want to see some of the of a PA chest. Any volunteers? I'll volunteer you.
I'll do it.
I'll be patient.
All righty. Amy and Lisa are going to do a PA chest. We're telling her to take in a big deep breath.
Go ahead.
I don't have that.
I will. I mean, we do, but...
That's good. Go ahead there.
Okay.
Okay, Lisa's going to be doing a PA chest for us, and Amy's going to be our patient. Okay, she is setting it for the correct distance. Now she's going to center the tube to our upright bucky, which is holding our film. Close them all the way.
Okay.
Yeah, go ahead.
And now she's going to center it to the bucky, which holds our film.
Okay.
Now you can go ahead and center.
Okay. Okay, Amy, you want to go ahead and put your chest against there?
Being a PA chest, we want the
Roll your
X-ray to
shoulders
come in
forward.
from the posterior
Okay, I'm going to bring this
through to
down.
the anterior.
Okay.
Her shoulders are rolled forward to make sure that the scapula are out of the lung field, and she's centering to make sure that she has got all the chest on the film, that she's not going to clip the bottom or the top of the lungs.
Okay, take in a big breath for me and hold it. Don't breathe.
Right, yeah. There we go. Good. Move it around a little or whatever.
And then just move it down. And I know it's centered already.
Good. Thank you.
Right there, under your head.
Hi, my name's Andy. I'll be taking a picture of your abdomen today. Let me go ahead and have you lie down on the table on your back.
Okay, Andy keeps checking his film. He has put his marker on the film to register whether it's right or left side of the body. We do all our table work, when we ever do anything on the table, at a 40-inch distance from the table to the actual film that he just placed in that bucky. And now he's going to line his light field up, or his tube, to his film. to do what we call a KUB, so he wants to make sure that the kidneys, the ureter, and the bladder are included on this film.
Okay, now I need to poke around on your side a little bit here. Okay.
If you could adjust these again.
Sure.
Just a close up of what you're doing.
Okay.
There. Yeah, go ahead. Thank you.
Mm-hmm. I need you.
Okay, and KUBs are taken on exhalation.
All
Okay,
right.
that's great.
First part's real easy. If you just say your name and spell it, please.
My name is Andrew Michael, AndrewMichael.
And where are you from, Andrew?
Indianapolis.
And you've already completed the part at Ball State, I guess, right? The on campus. And
Actually, I took all my courses off campus at Fort Bend, so I had a little different experience than some of the other people.
so you did the classroom. Now you're in the clinical. What's it like?
I enjoy it. It's a lot of patient interaction and a lot of opportunities to, I don't know. Let's start over. I don't know where I was going with that one. Where's my? I enjoy working in the clinic. It gives you a chance to really get in and physically work one-on-one with patients and help them through the whole process of recovery. There's a lot more to it than I would have anticipated. It's, there's more than just taking pictures of the bones. There's a lot of the gastrointestinal work that were things that I never considered before I started. So it's been a learning experience too.
How does Ball State fit into this for you? What I'm trying to say is how important is it that Ball State offers this program to you?
Well, it worked out really well for me. As far as coming from Indianapolis, they offered the off-campus courses that I needed to take to qualify. And then in conjunction with Methodist, I think it's altogether a good program, and it works out for me because of the location primarily. It also offers a degree, which a lot of the other programs that I looked into were certificate programs and didn't offer a degree. So that's primarily what I looked for.
Good, good. I heard you mention you had a wife. Do you have a family? So are you an older student?
Yeah, a little bit older than some of the others. I'm married. I have a house here in Indianapolis, so that was a prime piece for me, was to be able to stay located close to home. I don't have any kids, so that time part is not a big issue for me.
Why did you choose to go into this field, this career?
Because I dig chicks in uniform. Sorry. That's right. Well, primarily I actually completed a 4-year degree with an English major and did some general work in business, things that I didn't find satisfying. So I wanted to come back and learn a skill, a pliable trade that I could work with. The hospital setting really appealed to me, just because it gave me something that I didn't find in business, where I could actually be helping people, and working one-on-one with them without worrying about some of the other concerns that come in, in some of the general business world.
How many hours a day are you at Methodist?
Usually it's a full day. It's about 8 hours that I'm here, and then I work a part-time job in the evenings. So it's full days, and you have to manage your time pretty well.
What kind of work you do? I see here in the classroom when you mentioned clinical work with patients.
Mm-hmm.
What's a typical day like?
Well, we rotate each semester through all the different areas that the radiography is used in the hospital. So there's a lot of variation in your responsibilities from week to week, but it gives you a good chance to learn all the different areas, from surgery to the emergency room to fluoroscopy and some of the GI studies. So I'd say it gives you a really good base of experience.
Anything else you'd like to add?
No, thanks.
Okay.